Good morning. Welcome everyone to our second annual Wonder Woman of LSU Health panel. We're really excited that we're doing it in person this year versus virtually. We had our first one last year and it was over Zoom and it was a wonderful panel. We have one of our panelists with us today, Dr. Brenda Kennard. She's in the back. Thanks for joining us. We had a lot of interest in attending, so we're hoping people are just kind of trickling over and will join us as we go on throughout the panel, but we don't want to delay the wonderful women that we have here to share their experiences and their expertise. How it's going to work is our moderator will be asking some direct questions, and then there will be time for questions and answers after 4 or 5 questions have been run through the panelists. My moderator today is a dear friend, Ms. Carol Suggs. She is the former board chair of the LSU Health Foundation, where I serve as the Chief Development Officer. She's been on the LSU Health Foundation board long time, since I've been there, and I've been there for 7 years. And volunteer board service on the foundation board is a volunteer role. So they give a lot of their time to ensure that the LSU goes forward and progresses now and in the future. So we're really grateful for all that she has done for LSU in that capacity, in addition to her time as chairman of her helicopter company and serving in various healthcare ways that she's going to expound upon during her introduction. So without further ado, Ms. Suggs.
Okie dokie. Well, thank you, Crystal, for your kind remarks and for all that you do. You've inspired all of us. Well, when Crystal first asked me to do this, I thought, oh my God, do I want to do that? What am I agreeing to? Then I thought, well, you know, being with people that make a difference is about as good and best a vitamin as you can possibly have. And so I'm so happy that I agreed to do this. And of course, you all are all inspiring to me. Well, I'll tell you a little bit about myself and my involvement in healthcare. It's very different than everyone else in this room. My husband died in 1989, and I found myself the controlling shareholder of the world's largest helicopter company, which is a pretty daunting experience. And we operated helicopters all over the world and doing all sorts of things for government agencies, primarily, however, for the oil and gas industry. And then I guess in the early 80s, when there was a significant downturn in the oil and gas industry, we kind of had to find something to do with idle helicopters. And fortunately, you can do more with helicopters than you can do with boats. So we were able to create, and had been doing actually some aeromedical work, bringing people back and forth from the rigs. So my husband in his infinite wisdom decided that we would dedicate a business unit to emergency medical services. And at the time, Acadian Ambulance was just getting started. So we worked with them to really build our EMS business. And we operated some of the largest EMS programs in the country. We supported the Cleveland system, which was 63 hospitals. We had the huge program in Phoenix. And so we saw all kinds of aeromedical emergencies. And the thing that was so important was that you gave people another chance at life so often. When we were bringing people from an automobile accident or a child from a country hospital to the neonatals in the big cities, you made a difference, and you gave them that magical golden hour, which those of you in medicine know how very important that is. So making a difference in people's lives was something that was really very important to me. And I guess one of my favorite stories, and I've told it often, I think I've told it to my friends at the foundation, we had a program in St. Francis Hospital in Peoria, Illinois. And there was a young woman there that was a nurse, and she was living with her mother and father, and she was cutting the field behind her home. And she had a little 2-year-old girl, and the little girl ran out to see her mother, and the mother did not see her, and she backed over and cut her leg off. Well, fortunately, it's a good ending. Fortunately, the mother and the grandmother were both nurses and were able to stabilize the child, and they had her on the operating table at St. Francis Hospital in 43 minutes. Not only did they save her life, but they saved her leg. And when I went to Peoria, I guess she was 2 years old at the time. And it was maybe 6 months later, Sikorsky, whose aircraft we were operating in that program, always provided safety programs or safety awards for some outstanding program. And I was there to support my flight crew. And when I walked in the room, the little girl ran and jumped in my arms. Well, you will never know. I mean, I get cold chills every time I tell the story. The child's leg there was just a matter of inches in the difference between one leg and the other. But to have the feeling of knowing, which so many of you in healthcare have today, you made a difference in not only that child's life, but the life of our parents in a positive way, is as good as it gets. And so to be here today with this wonderful group of panelists and with all of you who make a difference is very special. And I thank you for that. And you all will have a good time today. We have some wonderful people here to tell you some wonderful stories. And I hope I have not forgotten anything I was supposed to say. So with that, I think you are going to talk next, Dr. Bayard. So
Yes.
moving right on along.
Yes, thank you. I'm Dr. Christy Valentine Thayard, and I am a mother, a wife, a daughter, a sister, a friend, a physician, internal medicine and pediatrics. I went to medical school at LSU and trained my residency at Tulane, and then went back to business school at the University of Chicago Booth School of Business. So I had medical practices in the New Orleans metro area for over 13 years. It was after Katrina, I realized that people were going to come back to the city. They needed quality care, and I wanted to be a part of that. And so I opened Valentine Medical Center and was able to really be of service to the community for over 13 years. I closed my practice in 2018, and I say that as I see the nurse practitioner I had the honor of working with, Ms. Kenya Knox-Lewis. So very grateful for that. I closed the practice, and now I am the president and CEO of Healthy Blue. So thank you.
And we've seen you on TV not too long ago, I think, right? All right, Dr. Giles, I think you're next.
Well, I'm Dr. Laurie Giles. It says Honolulu, but please call me Laurie. And I was a Tulane student with my husband-to-be, whom we met together at a casual meeting in the coffee shop. And I first laid eyes on him and said, now that's the kind of guy I'd like to marry. And he was in pre-med, and I was in medical technology. So we did get married the day after he graduated, but he had to go into the Marine Corps for a 4-year tour of duty. So my plans were I would work as a medical technologist and help save some money up so he could go to medical school. And during that time, I had my first child. And about a year or so later, right before my husband was sent overseas, it was his idea that I should go to medical school. And I said, what? And he said, well, you love it and you're good at it. He said, you do it too. So I signed up for the pre-med program at, not the pre-med program, but the medical program here at LSU in New Orleans. And I was accepted. I think I might have been the only, and the first rather, married woman with a 2-year-old to enter medical school. And then when he got out of the military and his flying career was over with the Marine Corps, then he came the next year. So we had a wonderful 4 years in medical school where we took turns babysitting during the night while one of the other of us was on call. And after a residency in internal medicine and cardiology and his residency as an orthopedic surgeon, we went back to his hometown in Mississippi, which was a very small hometown at that point in time. And I happened to be the second woman physician to come into practice there, the first being a pediatrician, and she was in solo practice. So I applied at a medical group that was already in practice in Hattiesburg. They'd been there for a long time, and they didn't want a woman physician. So I had no choice. I waited several months. They didn't call me back after my interview, and I began setting up my own practice. We had a magazine then called Medical Economics, and they had all sorts of good, helpful advices in there how to start a practice. And I started my practice, and about 3 years later, the medical clinic that had not taken me in as a partner wanted to buy my practice. But by this time, the rest of the physicians in our area did not want me to join the clinic. So I stayed in solo practice until Dr. Conrad Horicke joined me, who was LSU 65 or so. And I retired fairly recently, several years ago, because it was time to give up the reins. And I've been thoroughly in love with LSU for all of my medical career. Could not be here today if it weren't for them. And I wouldn't change a thing in my life.
Aren't we lucky?
Beg pardon?
I said, aren't we lucky for that?
Yes, yes.
Okay, Nico.
Okay, all right. Hello, I'm Dr. Noelle Morrow, and I am a Louisiana native. I'm actually from a very small town in Louisiana, and I'll mention it in case some of you know, but it's called Cottonport, Louisiana. And I went to physical therapy school at the medical center in Shreveport and got my degree. And after practicing for several years, I took a detour and worked at I guess you could call it a 3D motion analysis or gait analysis laboratory at a children's hospital that geared towards children with cerebral palsy. And so as I began working in that field, I think that's kind of a moment that really transformed my career and my life, because I realized a few things that I felt so passionate about these kids with cerebral palsy and trying to help them that totally shifted everything I did from that point. I also began teaching as an adjunct faculty member and began working in research, and that sort of led me to the realization that I needed to go back to school for my PhD to go into academia. So I went to LSU in Baton Rouge for a PhD in biomechanics, and then went on to pursue a postdoctoral fellowship at Washington University in St. Louis. And the whole time, again, investigating muscular and functional impairments in kids with cerebral palsy and ways to improve their function. And so that's really kind of guided most of my career. And I took my first faculty position at Medical University of South Carolina in Charleston. And then I was recruited here, so I decided to come back home to Louisiana, and I've been here 10 years. And I'm a professor in the physical therapy department here.
All right, Miss Linda.
Hi, good morning. My name is Linda Cow. I'm a pediatric dentist in the surrounding area. I practice in Metairie and West Bay. I'm a native New Orleanian, born and raised out of Charity Hospital, if anybody is long enough to know what Charity Hospital is. I'm one of 15, so basically I'm first generation in my family to actually be a professional. And so, being a woman, I think for me, triple grad, I graduated from LSU. I didn't get to flock away like these ladies. Financially, it was just a big challenge when you're one of 15. Graduated LSU in 2000. Then I went on to dental school. I applied in one school, begged them, and hoped that they took me in. And they did. And, once I graduated, I went into general dentistry for a year because I just wanted to, get a feel of what I went to school for. But deep down, I had that missing feeling like this is not enough for me. And so with that being said, after I did a year of general dentistry, I went back, applied pediatric again. I went to one school and applied to LSU, and I got accepted and matched there and went on. And once I finished, since then, graduated 2007, and I was going through pediatric during Katrina. So that was a whirlwind too. When you're displaced and you finally got accepted, it was easy to give up and say, oh, I'm displaced. I'm living out of 4 houses on living room floor for like the last 9 months till we finally found a place to stay. But you know what? I said I'd gotten too far to give up. And so I finished the residency and been teaching gratis at LSU. I'm a part-time faculty at LSU Dental School. I know we're so far away from the medical school, so I was like telling them, oh, my dental folks are not here, but that's okay. Teach gratis at LSU, and I also run my own practice. And and whatnot. And I did go back to school to get my MBA, 2014, and I did that at UNO. And so my passion is education. I'm a big believer of supporting education. Growing up, for me, I was very appreciative of every single little bit of scholarship I received. It could have been a $500 dollar for scholar. I don't know if I remember the dollar for scholar scholarship, or I could have gotten like this $1,000 scholarship from Walmart. But every scholarship helped, and it, cumulatively assisted me in getting to where I'm in today. And so, that's why, for me, I wanted to give back. And so we, meaning my husband and I, created a scholarship, and we were matched by the Louisiana Board of Regents to support the endeavor for my own department. Because as pediatric, we have a huge need and gap in what we provide care for that so many people turn away, because it's so easy to turn away and not treat these kids and not take care of them. And so that's where I come in there.
Good morning. I'm absolutely delighted to represent the School of Nursing. And I see one of my colleagues from well past. Hello, Gloria. Anyway, as you can tell, I don't really sound like I'm from here. Well, in fact, I'm a real Southern belle because I'm from New Zealand. And you can't get much further south than that. Now, as a New Zealander, I'm also a Kiwi. That's what New Zealanders are called. I did my nursing training in New Zealand. I got my diploma in 1964, and I'm wearing my New Zealand Registered Nurses Medal today. Now, in those days, they actually paid us to do our nursing training because we spent 5 days in the ward and 1 day in school, and we had 1 day off a week. I was a staff nurse in a very busy medical ward when a young intern came to the ward to do his rotation, and he chased me into the linen closet, and the rest is history. It was Austin Sumner who became my husband. And I have to say that truly, I have spent my entire almost 57 years of marriage trailing around the world, following Austin, carrying his train. But somehow, in between all of that, I completed my 3 degrees in the US. And I should tell you, as a nurse, a foreigner, it's quite hard to get licensed in the US. And it really took the whole 3 years that we lived in San Francisco for me to get all the bits together to be able to sit the exam to become a registered nurse in this country. They couldn't find psychiatric nursing on my CV, so I had to go back to school to do a course in mental health. Well, I'd done all that. I'd even been in a lockdown unit at one of the hospitals. But before we left New Zealand, I started teaching, and I really discovered that was my niche. And then I was known as Tutor Sister Sumner, because it was the British system, and rank meant that you became a sister. The uniform was very militaristic with tabs on your shoulders, but we all wore a veil. And yes, I really did wear a veil as a young married woman. I joined the faculty at LSU School of Nursing in about 1992, and I have taught undergraduates all the programs we have in the School of Nursing. I've taught master's students, and I still teach, sort of. I am an emeritus professor in the doctoral program. In fact, I was here last month and did a lecture in nursing ethics at the PhD level. And I still love teaching. I think some of the seminal events in my nursing career, other than being a teacher and a good, I hope, a good wife, you'd have to ask the boss that. But in Pennsylvania, I was a home health nurse and a home health hospice nurse. And there's no question in my mind that it was that 9 years as a hospice nurse that really shaped my thinking. And although I went to UNO College of Education for my PhD, they allowed me to write a nursing dissertation. And I wrote a new bidirectional moral theory of caring and nursing. And that is really what I still teach in the course that Dr. Gerentano is course director for. She asks me, very kindly and nicely, if I present my own work. And I'm still presenting internationally every now and again. But I am getting lazy, and I'm enjoying gardening and being granny and just having some fun. I'm off to Budapest on Sunday. And that's my story. I'm flying back to Vermont. Oh, one other thing, I know I'm taking up too much time, but I was a patient at Johns Hopkins last Friday. I had a pacemaker inserted. And if there was any advice that I'd give to any student, particularly in my profession, is remember the patient is a human being. They have needs. They're not just a pacemaker insertion or the patient that's got 12 levels of titanium in their back. And I think it's very easy in healthcare to forget that our patients have a past and hopefully a future. And I think that's all I need to say at this point.
Well, I think that's awesome. Thank you very much. All righty.
I'm deathly afraid of microphones. Anyway, so I think what we're now going to do is start with some questions. And I will start first with Dr. Giles. And my question to you, my friend, is who helped you along the way, whether professionally or personally? Was there a role model or a mentor, male or female, that helped or inspired you along the way to become the trailblazer that you are? You've certainly shared a little bit of your wonderful life with us, but let us hear some more.
Well, I always loved medicine from the time I was knee-high to a duck. And my intention was to become a nurse. My dream profession would have been to have been a nurse. But unfortunately, when I graduated high school, I was 16, and you had to be at least 18 to go into nurses training at that time. And it was no longer, at that time, nursing was not a collegiate profession. It was a hands-on profession. So instead, I went to Tulane University night school, and I worked during the day for the telephone company. And while I was working at the chemistry department that night on some of my classworks, I was asked if I would like to join the faculty and the staff, really, in the chemistry department, which I did. So for 2 years, I worked in the chemistry department, and in my junior year, I met this very interesting gentleman who was sitting at the coffee table with us one day, and I watched him, and I listened to him, and I said, that's the kind of man I would like to marry. But up until that time, those men never looked at me twice, so I forgot about him until about 3 months later when he started appearing quite regularly at my window in the chemistry department. And that was the beginning of my love affair with my husband-to-be. He graduated as a pre-med major on Monday morning in our senior year. We got married the next day because he had to go to 4 years of military training and became a helicopter pilot at the time. During this time, I worked as a medical technologist, and I had a child. And during the middle of this 4-year period that he was in the Marine Corps, we had engaged so often in medical discussions of the things I had seen that he was interested in because he was going to go into medical school. And finally, he turned to me one day and he said, you need to go to medical school too. And I said, what? And therefore, I went ahead and applied. And I think, as I said before, I think I was the only married mother of a child who started medical school at the age of 25. And I loved every minute of my 4 years at LSU. He followed me the next year when he was released from military duty, and we were able to successfully go through our internships, our residencies, and we went back to a little small town in Mississippi where he was from, and as I said earlier, I was only the second woman physician to appear in Hattiesburg, and she had to go in solo practice also. But again, I was fortunate enough to be able to find somebody who would rent me some office space. I found a examining table in the thrift store, which was one of the additions to my new office. And from that point on, it was all uphill. And I have never regretted one moment of the years that I have practiced in Hattiesburg, Mississippi. My husband graduated in orthopedics, and same thing there. He was a very professional and successful orthopedic surgeon and the farmer on the side, raising cattle on the farm. So we had all of our practicing years together, and we retired in the 90s, and I lost my husband a few years later. But I still love medicine, and I've
medicine
never
still loves you
regretted
too.
1 minute of all of the times that I've spent on the service.
Well, I'm sure some of the other ladies up here have some interesting comments to add of people that have made a difference in their lives and believed in them. If you all would like to share. I think, Jane, you did a wonderful job, but you want to do some more.
Of course, I'll never stop talking if you give me the chance.
All right, you
No
got it.
question about that. Funnily enough, I have to say, a bit like Laurie, in a way, Austin, my husband, he hasn't been a mentor, but he's shown me the way. Once I joined academe, having been in practice, I realized, having watched him go up through the professoriate, I knew what it took. And I was absolutely determined, regardless of him, that if I was going to stay in academe, I knew, watching him, what it took to move up the ranks. And so I set my goals quite deliberately to do that. I think, well, my mother would tell you that, and she's long dead now, but she would tell you that I was bullheaded from being a little girl. And I found a photograph recently of my sister and I in fancy dress costume. My sister's 3 years younger than me, and she was dressed as an angel. And I think my mother really thought she was. And guess what I'm dressed as? 6 years old, and I'm dressed as a nurse. But I do think there was one teacher who enabled me to stay in nursing, because I can assure you it's a very tough profession. It takes every single bit of you to do it well. And that was my first tutor sister at preliminary school, and her name was Christy Simpson. And her uniform would have stood up with starch without her in it. And frankly, the number of times I went and sobbed all over it, it was a limp rag by the time I'd finished, and I'd mopped my face. That would have been after a very tough day, a death or something of that nature. And at age 17 and 18, that's tough. So I really thank Christy Simpson for having enough faith to not say, okay, Jane, off you go, or Nurse Budge, off you go home, you're not fit for nursing. She enabled me to stay, and I'm still around. So I think, is that enough? I think that's plenty, actually.
Well, I think we all have somebody that believed in us. I mean, my husband believed in me, and I mean, which may have been a crazy thing to do, but he left me his life's work to carry on. And so I think we're all very grateful for the opportunities that have been provided for us by someone that loved us very dearly.
Yes.
Your turn.
Yes, thank you. Well, I've been blessed to have many role models and people just helping me along the way. First, of course, my parents were extremely supportive and the reason I'm here. But as a native New Orleanian, I know my second grade teacher, Sister Jean Marie. She made a difference. Xavier University, J.W. Carmichael, many minority physicians, yes, have been helped along the way by him. But then just people helping, I have Dr. Cheryl Bauer-Stevens that I have the honor of working with now, has been a mentor of mine. Gail Gibson helped introduce me to state work at the Louisiana Department of Health. It's just, I think that when you really lead a life of service, you're supported by many others. And that leads you to really, it inspires you to want to help and serve others as well.
Thank you. All right, Linda. Share a memory? from your career that always sticks out with you that changed you for who you are today?
So I was talking
I
to
mean, you're a
Doc-
special vitamin, so share that with us.
So, I was just talking to our panelists up here, and I have so many stories. It really doesn't necessarily mean change who I am, but really validate who I am. And there are countless stories, you know, as a dentist. The very first story I was telling Dr. Sumner was really funny. I was teaching at LSU, and mind you, we are very short faculty, especially in our department in pediatric. So here I am, I'm having to supervise dental students and residents. So I'm being stretched back and forth, you know, oh, hey, Dr. Cow, this patient won't sit still, or, oh, this, I can't seem to, you know, bond this tooth, what am I doing wrong, and such prep. So I'm running everywhere, I come up, and there's this dental student. He taps me on the shoulder, he goes like this. I go, yes? He goes, Dr. Cow. I say, what's going on? This kid won't open for me. I was like, what do you mean by he won't open for you? So I look at this kid, I'm like, okay, it's not like a young child. The kid's like at least 14, 15 years old. It's different. So I look at the kid. So the first thing I do, I look at the chart. Okay, medical history, insignificant. There's no behavior, there's no autism, special need. I go, okay. And I continue to look at the chart. I'm like, okay, this kid's had work done before. No major history of challenge, difficulty with behavior. So all I did was I went up to the patient, I introduced myself. He knew I was faculty. I sat down. And I said, open. He opened. I placed the topical, the little numbing jelly you put in before you do the numbing. And I said, okay, this is what I will do. Kid open. I put the jelly in. I let it kick in, talk to the kid, introduce myself, engage that child. You know, first, you know, introduce yourself. You know, I don't know if the student did that. This student is very timid and quiet. So then I said, okay, now this is what I'm going to do. I'm going to put a mouth prop in your mouth. And you feel this. So, you know, in dentistry, we always try to tell them, we desensitize the child. Stimulation, tell, show, do. So I said, this is where you're going to feel me push, and then I proceed, I numb the child. Then I deglove, I walked away. Then the student goes, wow, Dr. Cow, how did you do that? And I try to tell him, you, as the doctor, must command the authority. And therefore, that was the first day I realized, not only what I do in dentistry is changing the child, but more importantly, I'm able to mentor the student to see what the difference I am doing. You do have to see it as a child, understand where the child's coming from. I mean, from there transpired to the most recent event. I was telling Dr. Sumner, we had a young child who fell, knocked a whole tooth out. I was out that day, I was on vacation, whatever. Took 4 people to hold the kid down. They sent the kid to LSU Endo at the dental school. We have a team of specialists, the endodontics and pediatric. They tried 3 times, failed in vain, supposedly medical history, cannot sedate, child was hyperventilating, you know, whatnot. I said, okay, I'm in surgery, and I'm getting a call over and over from my staff, and they go, Dr. Cow, this mom's freaking out, they can't find no endodontist to do the sedation and the endo. I said, well, yeah, of course, because in our specialty, we're only taught to do pediatric. We're not taught to do root canals. However, when there's trauma, we do know how to open up the tooth, clean it, all of that. So I get a letter sent back from my faculty from the department endodontics. Dear Dr. Cow, we no longer can see this child due to behavior. I'm like, oh, rats. Well, who's going to see this kid? So the mom called me, cried in vain, over and over, don't know what to do. I said, the only thing I can do is open up the tooth and numb, but I got to see what's going on. So, again, sat the child down, lay papoose. I don't like to wrap kids unless I have to by all means, because child was deemed by my own department stating the child could not be sedated due to medical issue. Well, something's got to give. So all I did was I talked to this child, I gave it to as real as can be, and I said, look, you're either going to be held down to take this tooth out, and mind you, this is a front tooth, or you will allow me to help fix your tooth and keep this tooth, because anybody who knows when you lose a front tooth, it is very traumatic and very expensive to fix a tooth long-term wise. The psychological damage, besides the financial cost, is tremendous. So this kid actually lay still in my chair, did not fight me, did not kick me, I did not require extra assistance. And I was able not only to complete the partial nerve treatment, I even fixed and bonded both the front teeth. So I called my endodontist and go, oh my God, Dr. Cow, you didn't sedate? Are you sure? What did you do? I said, all I did was I talked to the kid. Now, this child is still in limbo because I don't do root canals, because we're not trained for it. My job is to manage the behavior. And so as a pediatric dentist, you know, I tell my doctors that anybody can sedate a child, anybody can put a kid under to sleep, but you, as a dentist, and I mentor all my residents, and they see it over and over, you have to be able to treat this child and be able to prove that you can do it and give them a positive experience. That is the most important thing, and that's probably the biggest challenge in my career and what we do in our profession, because so many times this child is a child of estate plan. Nobody was going to take the insurance. Nobody want to deal with the kid. Heck, what I did, I probably didn't get paid enough, but guess what? I know for this child 10 years from now, this child still has his front tooth, and that to me matters a big difference if you know anybody who's ever lost a front tooth. And that's why for me, it changed who I am, because I know that this is my calling, and this is where I come in as a teacher and as a provider of care for my kids who either have special need or behavior issues there. That's all I have, but I do have other funny stories.
Thank you. Okay, Dr. Valentine, your turn. What is the most important step to take to be a leader in your field?
That is a big question.
Well, you can handle it.
That is a
You've
big
done what you've
question.
done, yep.
Well, one of my mentors said, you get ready so you can be ready. And that to me means that you have to invest in the education that's going to be necessary so when the opportunity presents itself, you can say yes. And I think another important step, especially as women, is that we often talk ourselves out of our own success. We get in our own way. We will find 10 reasons why we should say no before we say yes to an opportunity. And I think it is important in order to grow in your field to say yes, because when you say no, they may not ask you again. Chances are they won't. So you want to answer the question yes, but be ready for that. So it's, I did not want to go back to school. I did not want to get an MBA. I was fine with my medical degree, but I thought, I was told, no, you really have to invest in continued education. And you even, you know, this was after I had my practices and did business and worked in the hospital and all the above. But the degree makes a difference. And so flying back and forth to Chicago every other weekend for nearly 2 years was a wonderful experience and one that I would not trade. But I think the main thing is saying yes and not talking yourself out of your own success.
I think that's wonderful, thank you. Does anyone want to add anything to that?
Oh, yeah. For me, being a leader, I always tell my own team, because I'm the owner, I'm the boss. To be a leader, you must also learn to be a follower. There are no job that is either beneath you or above you. If my sterilization girl needs help, I come in, I help break down, I help them sterilize. If my assistants struggle with doing an x-ray, I come in and I help. And so like I meet so many of my new colleagues, residents, they don't really know how to efficiently do an x-ray. And I tell all of my doctors who work under my wing, in order for you to correct this picture, whether that be an overlap or, you know, foreshadowing, you must know how to do it yourself. Because too often as doctors or as owners, you delegate. And to be a successful business, they always say, yes, you must learn to delegate tasks. But before you do that, you must also know how to do the tasks. You know, so I should be able to step in. If I have to mop, because a child threw up, which I've had, that's what I do. There's no job beneath me. I don't look at myself and be like, oh, you go mop. That doesn't work that way. I mean, I used to clean house for a living in between the jobs that I had to do to put myself through school. I mean, I had 2 jobs while I was going through college, and I worked with every job I can get, and I feel like all those jobs had taught me many levels of skill set in order to do everything I need to do. So, you know, and then there are times where leader needs to step away and let others lead. And that's how we grow, and that's how we allow others to learn to develop what leadership skill set they have. Because every one of us have a different set of skill set that makes us able to become a leader in whatever role we will be in. Whether that be, you know, my sterilization, my assistant, my management team, or just being the doctor, or even a teacher. So that's, for me, my input, like just, you know, let others lead while you follow and guide them. So, and let go of the rein, because some people are a little too controlling.
Leading by example is probably
Yeah.
is wonderful. All right, Dr. Sumner, if you could go back in time, is there anything that you would have done differently?
I think if I was giving advice to the next generation, and let me backtrack slightly, when you look at many PhD nurses, their career has often been stepped because nursing is predominantly still a female profession. And so that one is then a wife and mother very often. And so trying to juggle all the balls, you can't keep them all in the air. You just can't. And so, as I was sharing with Dr. Carr, my mother sent me to kindergarten when I was 3, and I finally finished school when I was 53. And so I'm a real step-by-step going up to get my degrees. And so I think, and I don't know the answer, but I would encourage students to not take the length of time that I did, particularly because when you are finally a PhD at my age, you have a short academic year for publication and presentation. And there is so much knowledge that nurses have, and if you look at the literature, it's very real, that if we could have got our advanced degrees earlier, we would have been able to contribute more in the long run. So, but one comment I think I'd make to follow on with Dr. Carr with the previous question is part of being a leader is the ability to listen and actually to want to be. I think sometimes you fall into these things, but I think listening and wanting to do is very important. So I'm sorry I went back to the previous question.
You can do that. That's what we. All right, Noelle, it's your turn. Can you share a piece of advice that was transformative?
So I was really thinking about this question, and I can't say that there's really like one piece of advice or one person in my career that gave me advice that was transformative. It was multiple instances of advice along my path at different key transitional points that really made a difference. And I also think advice it's what's really important about advice is the timing. So advice that might be given to you today that might transform something in your life maybe would not have had the same impact 5 years ago because of where you were. So I think that timing's really important. And just for me personally, it's just been these little snippets and pearls of wisdom that have really kind of guided me. But if I really think about, there were 2 times, one piece of advice, there were 2 times in my life where I was at a crossroads and trying to figure out what to do next. And I pretty much got the same advice from 2 totally different people, 2 ends of the country. And it went something like this. They sat there and listened to me talk about my dilemma and my crossroads and what should I do next. And they just listened and sat there, listened very carefully. And they said to me, not exactly the same words, but pretty close. I think you know exactly what you need to do. You just need to go and do it. And that was exactly what I needed to hear, and that's exactly what I did. So for me, that was probably transformative advice at key points. One was I needed to make the decision whether I was going to leave my physical therapy job and practice and go back to school for my PhD. And then the other transition was I really had this big dream or this big goal of having NIH funding for randomized clinical trials to really advance and transform clinical practice for kids with cerebral palsy. And the advice I've been given repeatedly throughout my career was, you're not going to get funding at NIH. It's at that time, like early in my career, the funding levels had dropped to where you had to be usually the top 2 percentile in the country to get funding. And then it went up to 10%, but still kind of wasn't looking very promising. And I just had this belief that I think if I could do this, I could do this. And I just needed someone to say, I kept saying, well, I need more mentorship. I need another workshop. I need another grant writing workshop. And they were like, no, you know exactly what you need to do. Just go and do it. And I did. And I have 2 randomized clinical trials funded by NIH right now. So simple advice, but it was exactly what I needed to hear.
Well, I think you also heard is don't be afraid to do what you need to do.
That too, yeah. Don't talk yourself out of,
That's exactly right.
opportunities and, yeah.
All right, so here's a question for all of us to think about. In the state of Louisiana, there's a significant number of health disparities, and they are very concerning. And both LSU and Tulane and the Cancer Center are working towards getting NIH designation. So what are some thoughts that you all may have about handling the many disparities in our community? Certainly, cancer is one of them, obesity is one of them, and it would be interesting for you all to share some of your thoughts.
I think for me, mental health, especially for my adolescent, we forget these kids will become adult, and these problems don't go away. So when we had cut the budget, I was lucky enough to be able to rotate through NOAA, which was New Orleans Adolescent Hospital, before funding was cut and that it was closed and then bought back by children. And I remember vividly the patient I met, and I was with my faculty then. She introduced herself to me, and it was just, it was the most heartbreaking thing ever. She said to me, "Hi, my name is Brittany. I'm 13, and I've been raped." And, it just catch you off guard because you don't know what to say, what to do, even to hug her. Then you read the file because all you do there as a dentist, dental pediatric rotation, you do assessment, you clean them, that's all you can do because there's no facility to treat these kids. And, all of these kids who need that help. And so it brings me back to even the kids I see till this day. I get pulled aside by the social care worker. I've been told, hey, this child was molested and all of that. And there's a lot of reasons why kids either act up or cry the way they are. And too often we do kind of like shove them away and be like, oh, they're just cutting up, acting up. And there's a lot of stories behind these. I mean, I grew up, I didn't really have role model, dysfunctional family, nowhere near, I was the only one for the longest time being in the health profession until I had to really nudge the number 8 child, the number 9 child, the number 10 child, because number 1, 2, 3, 4, 4, 5, I'm third, was just in and out, out of the system, and we didn't have any guidance, and I was that child who needed the help, but I made it through, and so I think somewhere, somehow, we need to bring back some sort of support and help for a lot of these kids who are going through this, because at the end of the day, they're not going anywhere. They become part of the system that will be let go and given up, and then these are the stories you hear why, sudden suicide, death, domestic disturbance, because these are the still same group of people who are still going to get married, still going to have kids, still having their own demons they're fighting with, and everybody turns head because we've never provided them the support they needed. And this was something I dealt with back in 2005. So I can only imagine, at NOAA it was either all homicidal or suicidal kids. And, that support to me has been taken away, and I hope that we can reestablish that in Louisiana.
Yes, ma'am.
I'm going to go in a slightly different direction. Part of the problem, obviously, is been lack of access, and I don't mean literally because you have to catch 3 buses. I do mean that. But I think once, I think it was Governor Edwards signed on to the Affordable Care Act, that opened up access to health care in a way that we hadn't had before. And before the charity hospital system was closed, and we all know about that, and it was, that did provide illness access. But what we've got to confront is the fact of health care, not just illness care. In other words, it's upstream. How do we prevent, whether it's the mental health problems or whatever it is? And I'm now going to give a plug for my own profession and also my own specialty. I was board certified in public health and community health nursing, and I would very strongly advocate that school nurses are in schools, that the budget for schools is not cut to the point where they let nurses go, because they're the ones that not only are doing surveillance with the children in schools, they're actually educating, whether it's for good dental care, whether beginning to talk about good nutrition, and how to ensure that children are getting good nutrition. They're not hungry. They can't learn if they're hungry. So I think to even begin to address the health disparities, actually it's nationwide. I now live in Baltimore, and the poverty in Baltimore, crime and everything else is just as bad there as it is here. And we're not addressing the healthcare disparities well, but I do think that the Affordable Care Act was the first good step because it provided access in terms of payment. And obviously the CHIP, which is the Children's Insurance Program, is vitally important for children. The expansion of Medicaid, access for all. Sorry, that's one of my hobby horses. Sorry about that.
No, that's exactly what you need to hear.
Yes. No, and I appreciate the different perspectives, because I've thought about this quite a bit, especially with COVID. Everyone, every provider, I think that's what I came to realize, is that regardless of the insurance card an individual carries, they receive the same care. It was an equalizer. COVID was an equalizer. So it didn't matter if you had Medicare, Medicaid, commercial insurance. You went to the hospital and you received those same treatments. But I think that what we're finding, and literally I had a physician group tell me yesterday, is that they are having to see less Medicaid patients because they aren't reimbursed the same. And so I think that we in our state will go far and be able to go even farther in addressing the health disparities that we have once we recognize that we are putting different values on different lives. That was a real aha moment for me, because you have providers who are saying, yes, those are my patients and I want to see the people in the community, but I can't because I can't afford to. So how are we saying that a Medicare patient's life is worth more, or a commercial patient's life is worth more than a Medicaid patient's life?
Or in my case, as an old person.
Well, and there are vulnerabilities on both sides.
Exactly.
There are vulnerabilities
It's
on both
very
sides.
scary.
Yes.
Can I say one thing about that
Well,
too?
certainly.
I think too, just as far as one of the ways to address it is that we really need more public awareness. I think a lot of people are not even aware of health disparities and how much they exist and in what populations. And then to take that a step further, I think that educationally wise, like physicians, allied health professionals, dentists, nurses, need to be educated on what health disparities exist and shown objective data and literature that's out there on these. And because if you're not aware, you're not going to be able to address it. And there's a lot of research out there that shows that many healthcare providers are not aware that there are health disparities. And so I think starting with some education and awareness is a good place to start, but only the beginning.
It has to start with the education of the children, and for all the right reasons. And I think, and there's no substitute for preventative medicine. And that's certainly going to start with the younger people. And it filters right on up to their parents, their grandparents. And it's got to happen, or we're going to kill lots of people unnecessarily.
Could
All
I
right.
just make a comment, having grown up with
I don't
universal
know,
access?
Jane, you're down to
Am
10.
I
You're up
allowed
to 10. Yeah, you can have another one.
You know I'll talk the leg off an iron pot. But
But you talk so beautifully, so we love hearing you talk. You teach us that.
you're meant to hear, not hear what I'm saying. Anyway, regardless, because I grew up in New Zealand, we had universal access. Now, that wasn't to say that there weren't some health disparities. The reality is there were. But there was never, ever the fear that you couldn't pay you paid came out of the income taxes. But it did mean that we got dental care. I was off to see the dental nurse every 6 months, and she had a clinic on my elementary school grounds. And those were the days there was no anesthetic and it was a foot drill, so it hurt like stink, as you might imagine. But regardless of that, everything we knew, whether it was the doctor's visit in his office or whether it was getting all the shots, whatever it was, we got access. And then when we went to live in London, my daughter was born in hospital under the NHS, the National Health Service. So it didn't cost anything. The home health nurse came and checked on us, both, baby and me. She and I had a good old time because, of course, I was a nurse, and so I don't think she even really looked at the baby. She just assumed. And I had my wisdom teeth taken out in hospital because they were impacted, thank you. At St Thomas's Hospital in London on the NHS. Didn't have to worry about access because we couldn't pay. And when we went to live in Paris for a year, exactly the same thing. We didn't need it, but it was there. And so coming from a different background, you can understand why I bring a different perspective. I'm sorry to keep changing and chopping around.
Well, that's perfectly all right. You can do that. That's why you're up here. All right. So what we're now going to do is we have a final 2 questions. And we would like to do what is called, I guess, in today's circles, a speed round, and allow each of our panelists to answer a question. So we will start with my friend right here, and we'll work our way down the table. The first question, ladies, would be, what advice would you give the next generation of women?
Well, my dad gave me some of the best advice and advice that I still use regularly. And that is, he worked with the IRS and was responsible for collections for the lower half of our state. And he said what he noticed was that women don't ask. So he would interview a woman, make an offer for a position, a job position, and she'd say yes, she would take the job and whatever salary was offered. Whereas men would come in and they would negotiate. And so first he made me read a book, Women Don't Ask, which was an excellent book, and actually recommended at the University of Chicago, which I thought was interesting and did not want to do at the time either, but it was very valuable. But he said, whatever you're offered, ask for at least 30% more, even if you're satisfied with the offer. So you don't take what is initially presented. And if they say yes really quickly, then you probably left money on the table.
More money.
Yeah, more, exactly. But if they have to think about it, you're probably in a sweet spot. And I think that that's important. Women don't ask, and you should not take the first offer presented to you. And that's been very valuable.
That's great advice. Dr. Giles?
Well, my mantra all my life has been that if you love what you do, you will never work a day in your life. And I think every member of this panel has expressed the fact that they love what they do. And no matter what the obstacles come in your lifetime that try to slow you down, get in your way, keep on the same track. Do what you love, and you will never work a day in your life.
That's perfect.
That's
All right, Noelle,
great.
yours.
I definitely agree. I was going to say something along the same lines, but that can move me to my second advice, which is I think it's really important to set goals and write them down, not just have them in your head or your dreams, but put them down on paper. Something about that makes it tangible. And always work towards those goals, especially when you find yourself struggling or off course. It can kind of be your guiding path. This is really what I want to accomplish, and I'm feeling off course, what's going to get me back on course? But then the counter to that is, but stay open to new opportunities and change. And that, as you probably heard across this panel, that career trajectories are not often linear. And I think as young women or even men, you think you have to do A, B, C, D, E, and you've got to do it just like this in this order. And I would say be open to the change, be open to something that's nonlinear and something that might take you in a different direction, and stay open to those possibilities. Make your own path.
Ms. Linda?
For me, I think my first and second question would probably be combined. For me, continue to hold on to some hope, whether that be a small hope or a big hope. Because at the end of the day, if you have hope, you can hold on to a chance that you can make it. I mean, I feel like I'm the prime example of not having parents who understand why education is important. And you have to follow this path by yourself. But you made it, and you can look back and you can say, you did it. And what made it was the hope, and that you look at other kids who are in a similar life as you. So when you meet different students and women, child, any diversity, any ethnicity, race, you let them know that you can do it. If you put your mind to it, have the hope that, for me, I was able to say, hey, look, I need to get out of this lifestyle. We were there were so many of us in a 1,100 square foot house. I kept telling myself, look, I need to keep my grades up. I need to earn that scholarship so I can get out of this world. And then what can I do to help the kids who are in the position I was? And, for me, the work-life balance, it falls in with the 4 H's in my life. Hope, having humility, taking care of your health, because without physical and mental health, if you can't take care of yourself, how can you take care of your children? If I can't take care of myself mentally, I can't come to work and treat my kids. Till this day, I go to work, I'm always enthusiastic. I hope I still continue to do that. I come in excited and happy because I enjoy to tackle the day, whether that could be this kid that could tear me up this day, or, a kid who could be fearful, who was referred, but you were able to get them out of pain, and they left with a positive experience. And happiness. You have to find what makes you happy. For some people, it could be running. Some people enjoy a physical activity that makes them happy. For others, it could be travel, or just cooking. But find that happiness. For me, that 4-H pillar that will help you balance in life. That's what I would do.
There's nothing much I can say to add to that, frankly. I think it's follow your dream. I've sort of fallen into jobs, and it's partly because, as I said, I was carrying Austin's train. And so wherever I went, because nursing was my passion, I would find a job to do. And I did it. And I've loved it, and I'd do it all over again. But I like the idea of having the dream, having the passion, and I like the idea of hope. Because, at my age now, I can look back and think of the hard times and also think, my golly, I always had nursing to fall back on. That was my passion, that was my dream. And my daughter is a neurologist like her father. Didn't do nursing, and my granddaughter is pre-med, so she's not going to be a nurse either. But they're following their dreams, and they will succeed. They're determined. And if there be advice, I would say you've got to be determined to follow that dream.
Well, I will share with you just a few of my thoughts. And I think one of the things I learned early on is you have to be yourself.
Oh, yes.
Life is not a masquerade, and if you know who you are and you're comfortable in your own skin, there's no battle you can't fight and win. And I think so. Just don't be afraid. Be yourself, and believe in yourself. And it's amazing. That's kind of a magical. That creates hope for sure. So, well, let's see where we are here. I guess the second speed question, and many of you all have talked about it,
Well,
Please share.
I didn't talk about the work-life balance because,
That's where we're going.
oh, is that where we're going? Sorry.
Well, I
Trouble
did a
with being at the end of the year.
I did a 2-for-1.
I'm trouble with- I got it both from Dr. Carr. and
Well,
I
all right,
thought,
we'll
oh,
start with you,
that's
because
it,
that
that's
was
the
where we
end.
were
Now
going.
can I go home?
No, we'll start with you. We'll come back this way.
Oh, crumbs. I've actually thought quite a lot about this because I've sort of juggled being the nurse faculty, being the wife, and because my husband was head of the department, I always seemed to have somebody for dinner. Somebody would be coming to stay. And when I was a visiting nurse, he'd call me and say, oh, Jane, so-and-so's just flown in from, I don't know, somewhere glorious, and I'm bringing him home for dinner. And I'd think, yeah, and he's going to stay the night too, because we lived outside Philly. So I'd say, all right, we'll take him off to Valley Forge Park, and I'd rush home via the supermarket, pick up a London broil. No, I could make a pavlova, which is New Zealand's only claim to culinary fame, and I knew that I always had some nibbles in the freezer. And by the time I'd got the firewood in and the fire was going and the table was set and the children were home and I had their homework going, and the guest finally arrived and I realized I hadn't taken off my coat and hat. Still in my uniform, hadn't written up my notes. So how did I manage that work balance? As much as I've always been able, I've had a garden. And when I was a hospice nurse, that garden was my salvation in that, and I'll tell you, and this was sort of part of what was asked before, but I didn't comment. When you're dealing with death, as you do in hospice, then you have to get that real sense of self and a balance in your life. And I found that my balance came from my garden, because the thing about a garden, and this was in Pennsylvania, is in the fall, we would put horse manure, we had horses, had to look after them too, they were my husband's, and then mulched leaves on the soil, and in the spring, with the burgeoning of new growth, there's new life. And that was how I dealt with my role as a visiting hospice nurse, and it was a very good balance. Now, the other thing I do is I've made bread ever since we've come to live in this country. So I've been making it since 1971. And I've always said the reason why I haven't punched my husband, and my God, there have been times when I'd like to have, was that I could punch the bread and get the dough ready. So I've always had a good life
Punching bag.
balance.
Punching bag, right. And you can eat it.
But just as a final comment, I do want to say that I am in awe of those nurses that have worked the 12-hour shifts in the COVID ICUs.
Yep.
They have been nothing short of remarkable. And they haven't really been able to achieve a work-life balance, because their shifts are long, they barely get home, fix dinner, go to bed, or if they're on night shift, and they're back again. And those patients die, and many of those nurses haven't really ever had to deal with death and dying. Now, if they're ICU nurses, it is a part of. And we haven't understood about the virulence of the disease right at the beginning. So I really want to give a shout out for my colleagues who have done such a remarkable, remarkable job. And I thank them because they have made the difference in so many people's lives.
Amen. Thank you. All right, Miss Linda, you're up.
That was already part of my two-part question.
Work-life balance.
Yeah, the 4-H of happiness, humility, health, and hope.
Yep.
But how can you do it when you're working in a COVID ICU?
Yeah, that's your role. Yeah, that's a challenge.
Well, I'm out, thankfully.
I feel like for me, right now, we're riding through this really tough wave storm, and you just have to hang on. You just got to hang on and know that you know, like with every rain, there will be sunshine. And so we're just going through this period where everybody's just stretched out physically, psychologically. I mean, even as myself, trying to make sure I be able to provide care for my, you know, patient. How do I make sure I maintain staff, a happy staff at that, you know, still being able to still give my time to teaching, goddess, and, you know, still being the mother. I am, you know, married with, like, I haven't talked about my kids and husband, but, you know, for me, just having a great spouse support. For me, I would say, I always tell this to all of my colleagues and my family. Who you with is either gonna make you or break you. That to me, I would just keep it as simple because so often I see people in just chaotic relationship, dysfunctional relationship, and it just spiraled down control. For me, I have such a supportive husband that we see aligned in every way, whether it be religiously, spiritually, you know, every aspect in our lives, we make the decision together. And so for me, you know, that's where I feel like my support is through my husband, and, you know, I always tell people, choose wisely, you know?
Wow. Noelle?
So we were starting to discuss this last night at dinner and how we're all working on this as well. And it's a continuum. So I think you're constantly reevaluating what's your work-life balance. And for me, it's like I look at what's important to me and then look at where am I out of balance, and then how do I address that out of balance to put it back in balance based on the things that are important to me. So that's kind of how I choose to think of it big picture-wise. And the one other thing that I've learned about myself is I'm very calendar driven, and so it's not enough for me to say, like, for example, exercise is really important for me, for my health, my well-being, my happiness. I went through a period of time where I was working all the time and not exercising. I realized I was out of balance. That's not good for me. So I made a decision. I was going to say 3 days a week, set up time, I'm going to go exercise. Well, it didn't happen. Always had an excuse, always could work a little bit more. Then I decided, no, it's going on the calendar. So once it's on the calendar, it's like it changed, it was a game changer for me. And I even had to go so far as to make it like, I had to go to an exercise class that started at 6 o'clock, because if I just said, I'm gonna go exercise at 6, no, it wouldn't happen. So I put it on the calendar, I scheduled it in, and I made it part of my routine. And then when I do my planning for the week, it helps you to adjust your schedule so that you know this is an important item. It's just as important as my research or my subjects or whatever, and it's on the calendar, and I've got to make accommodations. Maybe you have to get someone to pick up your children from school for you, or a dog sitter or whatever, but it helps you just plan and make it a priority. That's my tip.
Well, good. Dr. Giles?
I go back to love. Love your family, love what you do, and life will be good to you, no matter what. Period.
Those are wise words.
Definitely. I would say I
We
absolutely.
need to ask your daughter to tell us about her mother's work-life balance.
Well, you know, I think it is important to love what your loved ones love, to share that interest with them. So I know, you know, Stranger Things, watching that with my daughter, Monk now, Supernatural, us binge watching that whole series. So those things that are important to my daughter and my family, they're important, and actually I enjoy that. So although it is true, I love the work that I do. When I was in the office, I was exactly where I was supposed to be and loved every moment of it. And now I absolutely love the work that we do with Healthy Blue and know I'm exactly where I'm supposed to be. But you prioritize the things that are important to your loved ones. And so I have a lot of extra information about Phineas and Ferb and other things in my brain right now, which I enjoy because that's important to my daughter. She enjoys them, so we get to enjoy that together.
Wow, well, that's wonderful. Well, I think I can say trying to, because I found myself as a widow and having to go to work and travel the world work-life balance was quite a challenge. And my children, fortunately, one was in college, one was a senior in high school, but my youngest son suffered from it because he said, not only did I lose my father, but I lost my mother because I was gone all the time. So trying to find the time to make life special for him was really a challenge. So I encourage everyone to understand that, you know, your children, when you they need you whether you realize it or not, and it's tough to find the time to give them those very special moments. And so, but anyway, we're all doing very well. So now, I think I've got us on time, which is nothing short of a miracle for me, because I'm always late. But, so it's from the audience, and we would invite you all to please ask us questions. Not me, ask these wonderful ladies here questions, and we'll see what we can do to answer them.
I have a microphone if you'd like to raise your hand for any questions.
Surely somebody must want to ask us something.
Wait,
Do I need a microphone?
yes, you do.
Oh, my God. Hi, I'm Brenda Kennard, and I am a urologist, and I was the first woman at LSU to go into urology when I graduated in '85. And it's really interesting, you guys touched on this a lot, that without the mentors that are showing us, look, you can do this, you can do this, you can do this. Noelle, you had a lot of people that evidently told you that too. Then all of a sudden, your life takes different patterns. And when you think that you're not being a trailblazer all of a sudden, when you become like a freak, and then people like start to ask you for advice and everything, it's kind of interesting. So make sure that we keep passing it down, and I think this panel has a lot of to do with what you guys are trying to do with the foundation. There was a woman named Pat Heim, and we were able to sponsor her to speak with the Society of Women in Urology at our meeting one year. She wrote Powerball for Women, and she was saying what you were talking about, Chrissy, that men, you get these groups of men and everything, and they say, we have this job and all this, and men will immediately say, yeah, I can do that, having no idea how to do it. And women will instead say, well, I think if we were to do this, and they'll give it to the man every time that lied and said, oh, I know how to do it, and then they figure it out. So I think that as women, we need to, like you guys are pointing, say yes if it's something that you want and that you will figure out, because we're better at figuring it out anyway. And the talk that you were talking about with the humility, Linda, that, I mean, as a urologist, if there was an accident and I had my nurse tied up, I was cleaning the toilet. You know, you have to be able to have humility, but also empathy for the other people that are going to be coming in. You don't want somebody to come in your office and see all this blood and everything and know that, you know, oh my God, here's somebody else that was in this kind of trouble. And I really like what you were saying, because it also then feeds into the empathy. And I think that LSU Medical taught us so much about empathy and addressing, you know, health disparities and all. And I don't think that you find that everywhere. And I think we're really lucky that that was stressed. So good job, you guys. I learned a lot. Thank you.
Could I go back to the health disparities? And none of you, except perhaps for Dr. Gerentano from the School of Nursing, would know there's a new document called The Future of Nursing 2020-2030. And it's really a paradigm shift in nursing, because so much of our education is illness focused. This document is confronting the social determinants of health, which is what the health disparities are all about, and how if the nurse educators across the country and the leaders really follow what this document is saying, nursing is going to address health disparities in a way that wouldn't you agree, Gloria? In a way that we've never, ever addressed before.
Well, and that together with I think that together with the American College of Nursing just came out with new, what we call essentials in the curriculum.
Yes.
So at the same time that this document, and I think this led into that, of changing of us, and we're in the process of doing it here locally, but I think it's going across the United States. Yes. All those undergraduate basic nursing schools, starting with those programs up to the graduate, are revising curriculums to focus more on the health disparities, the diversity, implicit biases within our healthcare system. So all of those are now essentials. They have to be addressed. And so in the curriculum, throughout the curriculum, and show it as a competency at the end. So yeah, I think that we're seeing what's been happening. A lot of things, you know, at the bottom have risen to the top and hopefully improve.
Really, and I knew about the fact of what AACN had done. And we will be the trailblazers in the healthcare delivery system if we can make this work, because it will make all the other disciplines have to confront these issues square on. I'm very glad that nursing is the trailblazer.
Well, nursing, but also nursing gets the respect it rightfully deserves.
I'm sorry.
And I think nursing will have the respect that it rightfully deserves.
Yes.
And I think the thing that to me is so frustrating today, and so much of what we do, is the lack of respect.
Yes, that's
And it
absolutely
makes me
right.
blackboard scratching crazy. Because I see, you know, if the children don't respect each other, they don't respect their parents, they certainly don't respect their teachers. And we have got to bring respect back into our lives, because it's what we were all raised with, whether it was respecting, I mean, it's got to come back. And certainly into nursing, I mean, if you don't respect the people that are trying to help you, God help you. That's all I can say. That's my speech for the day. So anyway, we have another question?
Yes, I have a question. My name is Tina Gonaldo, and I work for LSU Health Sciences Center here in New Orleans. And so thank you all for sharing your stories. I think as someone who's in their mid-level career, I definitely have learned from all of you and resonate with everything you said. I would like to know, because every one of you has a different employee location or employer, how can we work as women to help our employers value opportunities like this? And so when Noelle talked about a calendar and scheduling this out, it was really easy this morning to say, I have to do some other things. Maybe I shouldn't go to the panel. But I knew it was important for myself and my growth, my personal growth, which you take care of yourself and you have to prioritize that. But what can you do? What have you done within your work or your employment to help foster other women to come together? How can we have this on a more regular basis except for once a year? I think that's my question.
Yeah, I think
Thoughts?
you're talking about, we need to do more in mentoring each other. You know,
Yeah,
where you're
and
going.
how can we do that?
I definitely think, I meant to say this earlier, that, women really need to work on lifting other women up, building other women up and supporting them. And, not all, men do a better job at this, I'll say in general. I mean, there's exceptions, but I think men in general are good at being team players, building each other up and helping. And I think women should really take that ownership as well. And so I think informally, whenever possible, in my different roles in the university, I really try to mentor anyone that I see is kind of going through a path that's similar to something that I have experience in, or if I've been successful in it, like, okay, I'm going to talk to them so that they can avoid some of the pitfalls or the things that I had to learn the hard way. I'm going to help them out and give them some tips, because I don't want them to fall or have the issues that I had. And so I think more of that is good.
Could I make 2 comments? Of course. In nursing, of course, it is a predominantly female profession. And funnily enough, sometimes the men students need quite a lot of support, because they're very much in the minority. And so it's sort of the reverse. Now, it is interesting that they often end up as the leaders, but they don't start out like that. So they tend to need the same encouragement and support that what we've been talking about for women today. So that's point number 1. The other comment that I'd like to make is my daughter, who's now a neurologist, a professor of neurology and neuroscientist at Johns Hopkins Medical Institution. And when she started in that department, there were almost no men. Almost no women at all. And she felt distinctly one down. She found that she wasn't getting paid precisely the same as the equivalent. And of course, now she's gone up through the professoriate and she's a full professor, and there's absolutely no excuse for them not to pay her the same as everybody else. But it's very interesting, in the 10, 15 years that she's been at Hopkins, women have suddenly burgeoned in all the disciplines, but particularly all the medical specialties, I should say, but they've got far more women in neurology there, And they're beginning to make a difference. There's just no question about that. Perhaps with less bullying, less dominance. And I find as the mother, and now I'll be the grandmother of another doctor who, even at this point, may end up in neurology. I can't believe it, actually. But anyway, the fact that when Charlotte started, she was, if you like, squelched by men, but now that doesn't happen anymore. And I'm hoping when young Isabel becomes a physician, that's finished. I'm just sorry that none of them are nurses. Got to support my own profession at all costs. Anyway, sorry, Carol, talking too much as usual.
No. But your wisdom. You're sharing all of that. That's awesome. We have another question?
Yes.
Hi, let me give a brief background about myself. My name is Courtney Bissonette. I work for LSU Health Sciences Center here as the pediatric nurse for the Early Head Start program. Let me give a brief background of my child who is 7 years old. She has CP and epilepsy. She's nonverbal, non-ambulatory, and she is the light of my life. Well, so that being said, as a pediatric nurse, and I'm still on your team with the nurse and peds, yes, that being on the other side of things, being a parent, a special needs parent, is definitely lacking in awareness, to me, what I feel. My child just got a trach. She got a trach a month ago. As a pediatric nurse for 7 years inpatient, now I got my master's in education. I've kind of like y'all have said, I've been missing something in my career. And I think that I've finally figured it out through this last inpatient stay, was that as much as I enjoy being a nurse preceptor, a nurse leader, I also know that my compassion and my drive is my child. And I figured out that during this whole entire, even though I was a pediatric nurse, we had to go through this whole entire trach training. And it was 8 sessions, learning how to do stoma care, learning how to do trach tie changes, emergency care, all of these things. And with staffing shortage, with all of the things that are going on within the medical world right now, it was very time-consuming. And it just made me start thinking, what about these parents who can't actually be here every single day, because I was luckily able to take leave off of work to be there every day. But I'm like, what if these parents do that have to come in just on the weekends? That these patients are staying in this long-term care, and these parents are only able to come in on the weekends, and how long these patients are actually staying within the hospital. And the stress on the parents, the stress on the patient and the child, I just felt like, I was like, okay, Courtney, I think you found something that you can drive to. And I figured out that, of course, in my daughter's, name and her legacy, which we do, her Facebook page is Hope for Ani, so we're all about the hope aspect. She's actually had 4 cardiac arrests as well, and has survived every single one of them. So there's a lot of hope, and there's a lot of hope in myself that I can start an organization that helps with the education prior and post of any kind of special needs procedure, trach care, G-tube, anything that's medically complex. And I feel like it really needs to be done, especially here in Louisiana, because there's a lot of, health disparities that in health education lacking that needs to be done. So after all of that being said, my question to all of you is where do you think that I need to begin and where I need to start personally trying to create this foundation organization that I want to do for myself?
The Greater New Orleans Foundation,
Yes.
Okay.
That's right.
that's where I'd go.
Yeah.
And a business plan.
Okay.
That's exactly what I was gonna say.
You need a business
MBA
plan.
degree could give me just like mine.
Yeah.
Start with a mission statement. So you start with your mission statement. What is it you're looking to achieve? Then, if it's a nonprofit, you say, look, how do I seek support financially? What would it take? Do you have to have a board group there with that nonprofit organization? And then, have a short-term goal, long-term goal of what you see that would transpire from it.
Right.
And to me, that's kind of what I would start with.
Perfect.
Absolutely, you're right.
Awesome. Thank y'all.
Well, and good luck to you.
Yes.
Good morning to everyone, and particularly to Dr. Christy Valentine Thayard, who is my amazing boss. So I'm Kathy Victoria, and I serve as the Medicaid Territory Marketing Manager for Healthy Blue. I know that's a long title, but the work behind that title speaks for itself. One of my favorite quotes is by Brigham Young. You educate a man, you educate a man. You educate a woman, you educate a generation. Women have so much power, and sometimes, as Dr. Valentine stated, we don't think we have that power to make a difference, to make a change. In healthcare, with Healthy Blue, we deal with Medicaid expansion, children's health insurance, et cetera, et cetera. Too often when I'm in the field, I see individuals who receive Medicaid get totally treated differently than the individual who may have insurance like all of us in here. So what have you all done, or what example can you give when you see a patient with Medicaid and you see probably one of your colleagues attempting to, probably unintentionally, but sometimes intentionally, attempting to dehumanize that person because he or she may have Medicaid? I'm passionate about that. And when I'm in the field, we go hard because our members are our lifeline. Our members are the reasons we have these beautiful jobs. But what have you seen this? If you have, can you give us an example of how you shot down your colleagues possibly attempting to dehumanize an individual because they don't have the Medicaid that they think this individual should have?
I think that's a tricky question, and I understand completely where you're coming from. I had an experience when I was in home health administration down here with the AIDS patients, and they were on Medicaid, and they therefore were only allowed to have one nursing visit a day, and if they were beginning to get the mental changes, nobody could come back. They were meant to stop their own IV, but nobody was allowed because Medicaid wouldn't allow that second visit. And that used to make me so angry because that patient really wasn't safe. And I've been prepared to tackle whomever I can find and take them on about it because, as I said, right at the beginning, every patient is a human being and they're entitled to the best care that I, Jane Sumner, can ensure that they get. And I will go and fight for that patient to my best of my ability, and have. I've got some stories about some other things I won't share with you right now. But I think in the instance when you've observed a colleague, you have to take that colleague aside. You don't address it in front of the patient, ever. but you do address it with that individual who has had the gall to treat a patient like that. And I have certainly done that before. And having been on the receiving end, I've been a patient, I don't like it. And it doesn't matter whether they're orange or purple, yellow or gold, green, Mardi Gras colors, they're still entitled to us to give them the best. And it's up to us to take on our colleagues when we see that lack of compassion and empathy and all the rest. You know, it really makes me boil. Don't take me on, the big guns get fired.
Yeah, you know, what you said, I mean, you know, it becomes political. You know, like even in what I do, my profession, I know people nationwide, many of them don't take Medicaid. Because once they become trained, they see fee-for-service. Why? You see half the patient make the same. Why? I mean, I had an associate that told me the other day, oh, such and such see half the patient make the same and, you know, whatnot. I said, well, you know what? You can ask any of my staff and any of my patient. They don't get any difference in quality of care. Heck, I had a patient that I had a meeting, and literally before that meeting, mom, new patient by the way, state insurance, huge laceration inside the lip. My mindset was, okay, if I send this patient to the ER, they're gonna wait for NBO, another 6-7 hours, because your child just ate, and you're gonna be there for 7 hours. Or I can do this in 15 minutes and be on my way. I didn't have to see this patient. She was a state patient. A laceration, a little bit outside of my treatment, but not really. It's still the mouth. But a lot of times, who can manage a mouth better than a dentist? I mean, how often you see internal medicine doctor who's gonna be like numbing, because you truly don't, you know, we're more proficient at numbing there. Because, I mean, I know a lot of times even with derm, you go into little subderm, they're gonna feel it. You guys know that. So IV is the best way to go, but this child was NPO. I didn't turn this child away. Same thing like that kid that no one wanted to see. That was a state patient. You know, no one's gonna accept the insurance because reimbursement is 4 times less than what a specialist endodontist would pay for. And so, only thing was I can give this child that hope. And so, my mindset is, if this was my child, what would I do? And that's what I live by. I mean, I grew up poor. I mean, like, heck, you know, we had nothing. I mean, you know, literally I had to literally earn my high school package to pay for my graduation. My mom didn't give me a dime because it was just 15 of us. Literally everything I spent for, I only applied one college at a time because that's all I could afford. And living by that mantra, I grew up like that. I have to be able to give back because I have to live what I stand by. I was once that person. And that's what brings back to what I talked about, the humility part. Remember your roots, remember where you come from, and do your best to give back in every way you can. And I do my best to do that in memory of my chairman who believed in me. And I get to talk about that. I mean, he was the first Black chairman in the Department of Pediatric Dentistry. I was intimidated because I felt like, had I applied, I probably wouldn't get a chance. Because you're looking back, same thing, you see the politics. Only certain people get in, child of a doctor, like that's what you would believe in. And you know, only after a year, I approached him after the deadline was over. I mean, I can say this now. I missed the deadline for the application for that particular year, but my chairman told me, Linda, if you can get all of your stuff ready by the time of this interview, I will grant you the interview. And you wouldn't believe the high hoops I had to jump driving to LSU everywhere because they sent the wrong transcript to get all my stuff together and ready and show up for this one interview that made all the difference in the world. You know, so that for me, you know, the issue with the Medicaid is, for me, I don't feel like any of my colleagues in the city don't see the patient. When they do see the patient, they treat them very well. You know, however, is there a situation where there's a lack of so many, how would I say, providers? Yes. So, you know, the issue is the reimbursement. They only see so much because they're not getting paid as much. Why would they want to break that back? But for me, we still see the patient. I would never turn away an emerging child. If you have broken your tooth and you come in right away, you will be seen. Now, you tell me you have an emergency, but, oh, I can only come in by the weekend or the Friday. No, boo, that's not an emergency. And see, that's where it comes in for us. We never turn away a patient. You can ask my staff and my front desk. We never turn away a child like that. But I do see the disparity of that. And I know that in countless ways, I don't wait for a Give Kids a Smile month to provide care. But sometimes that is what it is. Oh, they're providing care for the state, because for some people, that's the only time they want to show it, they give back. No, I mean, you're getting paid still. So treat them as you would treat your own kids. And for me, you do that, I would never feel like, oh my God, I can't sleep well because I didn't provide care.
I think there's one other comment, and I'm sorry to butt in, but the comment is, how many of you in this room ever contact our two senators up in Washington, D.C., Kennedy and Cassidy being a physician, and let them know as health professionals what particular needs are? I learned this when I was on the board of the National League for Nursing. I was on the board for 6 years, and every year I trot up to the Hill and talk to the legislators about whatever the issue was, and there was always something, and there was always the issue about paying more for nursing education. But I still contact, just by email, sending a letter, and they do get read. Now I'm living in Maryland in the winter. I contact the senators there, and I'm actually still very tempted to contact Dr. Cassidy down here because he's a physician, and he needs to be reminded of certain issues, whether it's the Medicaid issue or whether it's mental health. It doesn't matter what it is. I think it's very important that we as health professionals contact our political animals, because we can't expect them to know what we know about our respective professions. And I think it's time I shut up, actually.
No, but I think you're absolutely right.
We have
They
another
don't know what
question.
they don't know, and if they hear from all of us, we're in good shape. All right, yes, ma'am.
Hello, I'm Kenya Knox Lewis. I am a 2012 LSU graduate nurse practitioner, family nurse practitioner. I looked around the room. I have several mentors here that were very instrumental in where I am now. I have two questions, one for Dr. Valentine Thayard and one for Dr. Kyle. And it's kind of what everybody's talking about right now with the disparities. So the first question is, since we know that there are disparities between Medicaid and Medicare and commercial insurance, since Dr. Valentine, you're the president and CEO now over the Healthy Blue, what kind of incentives do you think, because I know that providers do turn away Medicaid patients. They don't have to see them. And there's so many people that need care. So are there any incentives that are given to providers to see more Medicaid patients?
Well, that's a great question, Kenya. Yes, we do actually have value-based programs in place so that providers are paid for quality care. And so given your patients meeting HEDIS metrics, making sure that you are up to date with, say, child immunizations or controlling their blood pressure or whatever the measure may be, there are value-based payment arrangements that you can enter into with any of the managed care organizations so that you can get paid above and beyond the fee schedule. I think that there's an opportunity for education there and making sure that providers are aware that they're available. We do a lot of work in making those arrangements available, educating providers, working with them to make sure that they are providing our members, their patients, quality health care. Is it everything? Is it absolutely enough? There's more that could be done. And I think it has to do with what I said earlier, recognizing that lower fee schedule, you're making a statement with that. You have providers making decisions on who they're going to put on their schedule based on the card in a person's pocket. And it really is something that I think we were talking, you mentioned biases earlier. Those are things that you can really stop seeing because it becomes normal. And in healthcare, it's normal. Verify the insurance, make sure they have coverage, what is their copay? You kind of just start going through those motions without realizing the fact that those differences in reimbursement back to a practice, which is a business,
And speaking on the business that you're mentioning, that you want to start with your daughter, it does go back to the business as well, because you have to have a healthy, viable business practice in order to continue to be of service. So I think that it really is going to take that legislative action, reaching out to legislators, but even before that, reaching out to their constituents so that they understand the questions that they need to ask of the people that are representing them.
And my second question was, I know that the Medicaid covers dentistry for children under 18. Do you find that a lot of Medicaid patients take advantage of that, going to the dentist, getting checkups? Because I know, like for me, when I see young adults, especially the ones that are under 18, I push them. I'm like, when's the last time you went to the dentist? You know, go to the dentist, because when you're 21, you don't have that care, and dentistry is expensive. And so, you know, and I push, you know, these are your teeth. You're going to have them the rest of your life. You might not have them. You know, so do you see young kids that come in for regular checkups? Do they do it? And if they don't, what can you do to try to push that and make them get checkups?
This question can really go off the grid, and you can go on the topic for so long. I would tell you, as a Medicaid provider, it's been 10 years since I had a fee increase still. And while that is being said, my expense still goes up. My salary for my staff goes up. And I would tell you, even for, let's say a child has a limited exam, you know what the fee is for that, for us to get paid? $15. And if you work that child in because the child had pain, you don't get that exam fee. You do not. So $15 doesn't even come close to paying for the paperwork that you do and all that stuff. $15, a limited exam code, and you work that child in. And I get these kids coming from very far places, Houma, Thibodeau, okay? As for, I even have patients from the North Shore, because no one else would take their insurance. And they find you all through word of mouth, because a lot of times I don't advertise. And they find you and they say, hey, look, you saw my cousin, you saw my sister-in-law, you saw my, this is what you're able to do. I mean, I will tell you, there are countless times where I'm doing work, I know I'm losing money. But there are times where it's just like being a waitress. You get $2 tip here, and I used to be a waitress for a long time. And I'll tell you, you look at it collectively, because at the end of the day, you're providing care, you know, and all of that. But the challenge that we have is they turn their heads, because even on recruitment, it's like, for what I do, because I can manage this child, they won't pay you for behavior management. But yet somebody else handled the kid, would traumatize the kid, and you end up in the hospital. So Medicaid itself, the management group, you know, the issue is we do need representation. And our organized industry, meaning we have an organization, are we like on top of it? They're working their best. I know that we do have people who lobby, but it's been an ongoing struggle to the point where now post-pandemic, most people don't take it. And so, you know, and the parents don't take advantage, it's double-edged sword. They'll miss several appointments, and right now I'm getting such a huge influx of kids, all swollen jaw, all abscess, all waiting for care. Why? Because this child won't cooperate in the chair, all scheduled for hospital, which I'm limited to only 3 days a month at children. Now that's a whole nother politics. You're given 3 days, and you know, as dentists, we can't even do our H&P because we're dentists, but they're not allowed to go see their own pediatrician. But yet my son, who didn't even get clearance for H&P, gets surgery the same day. So that's the reason why I can't even get patient in while they're still a long wait. Literally, I had 5 kids already. Came in, all abscess, all swollen, all had to be taken care of, and they all needed, I mean, these are kids who are too young to understand command. That's where the difference comes in. If a child is scared, and I can show them it's not gonna hurt, that's easy. It's a child who cannot cope yet, who doesn't understand. They're 3, and they're 4. I mean, you know, even if they do great for numbing, which the majority of them do, they don't understand that, oh, they gotta have a tooth pill in the mouth, they gotta have rubber dam. And these kids are stressing, and I have had several kids come in this past week. And even after this, I have to run to go help in clinic because everybody's just waiting till last minute. So how can we help this? I need engagement from pediatrician to encourage the kids to go. I need encouragement from like the healthcare unit to go. Again, it goes back to politics. Oh, wow, we don't have somebody we're going to. Well, who are you applying to? I mean, I don't want it to be like a marketing thing because anybody who knows me, I'm working because I love what I do. I can retire the next day and be like, done with, go teach, go do organized industry. I'm dividing my hats and do everything I can do. I'm part of the organization my dental association. I am part of the foundation because I'm trying to help the foundation open their eyes to what we have a huge shortage when I teach. I'm in a quiet room that's not quiet, meaning there's nothing. I'm in a room where my residents are having all the needs that they have set up, a little bit of lacking certain things that I would not be comfortable managing. And so, you know, we're struggling just in the outside world and in the teaching phase, you know. And so for me, we just need more raise of awareness to say that, hey, look, we need these kids to go get their teeth checked and all that, because an ounce of prevention goes a long way.
Well, back to what Jane said earlier about school nurses. How simple it would be if there were school nurses, so much of this would be preventable.
Oh, yeah.
Does
Oh,
anybody
yes,
else
maybe.
have any questions?
We have one more.
Because I'm about to hit my time clock here.
Last
Or be
one.
told my time clock's running.
Hey, everybody. First of all, just thank you so much for your wisdom and just sharing. I just wanted to just say a couple of points. As a Dillard nurse and also LSU nurse, we were taught that nursing began at the door. You know, before you even entered the room, you were able to make some type of assessment of what was going on and then get permission, as you talked about before, to move forward to take care of them. To the young lady over here who is considering a nonprofit or whatever, I would say to you, as you've gotten also information from the panel, is that pick out those special points about your daughter. Let that be your story. And then you can put, as a nurse, that medical element to it. So it's almost an anatomy of your daughter, you know, where they see her mind, see her heart, see her warmth, see her resilience, and see how that pairs up with what you also see. Because even in some of the discussions I've had with parents and those types of things, even though I'm a nurse, you have to know your audience. So if you're in a room full of grandmothers, you can say, well, I'm a grandmother. Then you have your connectivity. Then you have a conversation. I'm a parent. Let's have that conversation, right? I think you're onto something because it is so intimidating to come into spaces where you want to ask questions but don't know how and not even know if those questions are going to be valued or not, right? So I applaud what you're doing. I applaud the panel. I'm just so excited just to be here and as a nurse. Just to be here as a nurse and just to see how nursing is transforming. And lastly, say this, that it does take a village, but you also have, with the organization that you're going to form, there are persons in places now. Find out who your community liaisons now. See if there's opportunity to be a part of the grants that they are applying to, so you can at least get some type of foothold on what you want to do. But I think it's a wonderful mission. I think you need to move forward with that. And thank you.
That's wonderful. Crystal, I thank
All right.
you all. I enjoyed being your mother for the day, and you all were wonderful. Thank you so very much. You made me proud.
Carol.
Thank you, Carol.
Keeping us in check.
It's a hard group to keep in check.
Oh, yeah.
I want to say thank you to Carol, Christy, Laurie, Noelle, Linda, Jane,
The girls.
the women.
The women, the ladies. I like the ladies, the ladies, the ladies.
You know, there were a lot of interest in coming. Obviously, the calendar, maybe it didn't get put on the calendar, Noelle. So I am saddened at the turnout because I do feel that this panel was so inspiring. And, you know, when we coined the panel, the Wonder Women of LSU, it might have felt a little juvenile or childish. But really what inspires me when I watch those movies, and some of you know Wonder Woman, Linda Carter, the cartoons, you know, as a woman, when I was growing up, there was Superman, or they were all men that were in these environments where they were facing these insane obstacles and challenges, and then somehow they prevailed, right? They found a way to be successful. And now we're seeing women in those roles facing these challenges and then prevailing and having success. And that's really what these panels are about. It's about us coming together and sharing our shared experiences that we are prevailing in the midst of obstacles, whatever those obstacles are in your fields of nursing, dentistry, physical therapy with Noelle and cerebral palsy, with Dr. Giles and cardiovascular, and then Thayard with internal medicine and doing Healthy Blue and really facing the disparities with that organization, which is so important. And Miss Suggs doing a myriad of different hats across multiple disciplines, all of us coming together. Linda really resonated with me in her comment about hope and hanging on to hope.
Yep.
We share similar childhood backgrounds. And that was always, for me, what inspired the panel was knowing that I had to go out and find my own mentors, which means I had to be open to learning from the people around me. I had to recognize that I needed help and that no one in my immediate circle was going to give me that help, so I had to go find it, which meant I had to be open. I had to be open to seeing success mirrored in front of me and then going and asking the questions and then being like, oh, that's what I need to do. Okay, that's what I need to do. I got that. And then figuring it out as you go along. And you cannot be afraid. You definitely can't be afraid. But it just touches on all the points that all of you mentioned about, you know, being open, being ready for opportunities, not saying no, asking the questions women don't ask. That is so true. And sometimes you're in a situation that if you don't ask, you're not going to survive. You're not going to make it to the next thing. And so I'm just really grateful for all of you women today, for being here, for sharing your experiences, for being part of our fabric as an institution at LSU Health, whose goal it is to train the next healthcare provider for our community. And those healthcare providers wear a lot of different hats and provide care in so many different settings. And I'm grateful to be a part of it, and I'm grateful for all of you. Thank you, thank you, thank you. We look forward to having this again next year. Please tell your communities, your friends, about this panel. It is a really wonderful opportunity to connect and to network and to learn from one another, and I think that we can all do better at that. And so thank you. Lunch is back on the table. Please help yourself, and feel free to mix and mingle for a little while and get to know the panelists a little better. Thank you for coming.
Thank you, Christy.